Thank you, Raktim sir. Thank you, Rohit sir. Ma'am.
Shri Raktim Das, CGO TV9 Network, Rohit Sharma, ED DLF, and Pratap Singh ji, Principal Commissioner, IT. Distinguished guests, ladies and gentlemen, and everybody who's a part of Team TV9 Network today, who's present here and has been involved in organizing this summit. My greetings goes to each one of you. I thank the organizers, TV9 Network team, for having me here. And I also congratulate them for holding this summit on a very important theme, building a new India. In fact, this discussion is taking place today at a very opportune time. Why? Because the Prime Minister of India has a big dream for this nation. When he launched the vision of Viksit Bharat, a developed India for 2047, he said that there comes a time in the history of every nation when you have an opportunity to make exponential strides in your development journey. And he quoted so many examples of countries around us who have actually worked very hard, made a quantum jump in a set time frame, and have been successful in transforming themselves into a developed country. So when he says there is a time in the history of every nation, when is the time for India? The time is now. The time is today. This is the time, and this is the right time. In the words of the Prime Minister, yahi samay hai, sahi samay hai. The time to transform the nation is the next 25 years. And where everybody's contribution is needed, because building a Viksit Bharat, building a new India. What is a new India? It's a prosperous India. It's a self-reliant India. It's a developed India. And building that kind of India is not just a government program. And it cannot be made into a reality with government machinery's dedicated efforts alone. It has to be a collective dream of 140 crore Indians. And when 140 crore Indians' energies will come together, this dream can be realized, and developed India would be achievable. So which is why I'm here, and I take this opportunity to urge each one of you, wherever we are, in whatever capacity, we must contribute towards the fulfillment of this big vision. When we talk of building a new India, there are several sectors which have got to contribute. And there are so many sectors which are today charting the growth story of India: infrastructure, startups, healthcare. And my responsibility today in this government is in the healthcare sector. When I work under the guidance of my senior minister, Shri J.P. Nadda ji, and we both together make efforts. Of course, I have one more colleague minister with me, Mr. Pratap Rao Jadhav ji. So we work together to ensure that the healthcare sector, the healthcare landscape also transforms in the direction of creating a developed India by 2047, which is the next 25 years when India completes 100 years of its independence. So when we talk of health, there are certain things that I would like to share with you, because we made a lot of progress in the past 10 years, which is the 2 tenures of Narendra Modi government. The first and the most important step, I would say, was the rolling out of the National Health Policy in the year 2017. And it was my privilege to be a part of the Health Ministry even that time when this new policy came into operation. And this policy focuses on attaining universal health coverage through patient-centric approach, which means affordability, accessibility, as well as the quality of healthcare becomes of prime importance. And all our schemes and programs have been designed in light of attainment of the goals of the National Health Policy. When we say a developed India, in terms of healthcare, it is a country which is able to attain universal health coverage. So what are the pillars on which these goals can be achieved? The health policy today rests on 4 important pillars towards which we have been working very fast. The Ayushman Arogya Mandir. This is one phrase that you hear often from the Prime Minister. How at the grassroots level, the Ayushman Arogya Mandir, which is the most important pillar of the Ayushman Bharat program which this government launched, are transforming the scenario of healthcare services delivery. These are the most basic units, the sub-healthcare centers, the primary health centers in the rural or the urban areas, which have been redesigned in a way that they offer a package of 12 different services which assure comprehensive healthcare services to the common man. The second, of course, is the Prime Minister Jan Arogya Yojana. And you have read enough, you have heard enough, you know it all. This is the world's biggest health assurance scheme which provides a health cover of 5 lakh rupees per family. And how many families? When we conceptualized the scheme, there were 10.7 crore families. But later on, the states also converged their own scheme and the number grew bigger. 12 crore, 34 lakhs, 37 lakhs. But we further expanded it to even include our frontline health workers, the Ashas, the Anganwadis. You must have heard the announcement in the interim budget this year in February, when we decided to provide this cover to the frontline healthcare workers also. And before elections, Prime Minister also spoke of government's resolve to extend this health cover to the elderly population of the country who are 70 years of age and above. And that proposal is being actively considered by my ministry. So it's going to be, I would say that it would be too ambitious to say right now, but we somewhere believe that we should be able to cover 100 crore people, 100 crore individuals by way of Pradhan Mantri Jan Arogya Yojana. And health infrastructure, which is often been talked about. And the inadequacies were highlighted, especially when we faced the pandemic, COVID-19. That was the time when Government of India decided that health infrastructure strengthening is also one of the very important pillars that this government is going to focus upon, and which is why we came up with our third pillar, which was PM Abhim. And with this program, we are trying to strengthen the capacities of our primary, secondary, and tertiary healthcare, our existing healthcare institutions, and also creating new infrastructure to cater to the detection and cure of the new and emerging diseases. Nowadays, you hear of a new virus strain every time. So there are so many emerging diseases. So more and more of strengthening of our infrastructure and healthcare capacities is required, which is what we plan to achieve under PM Abhim initiative. The fourth and the most important pillar of Ayushman Bharat, which seeks to fulfill the goals of the National Health Policy, happens to be the Ayushman Bharat Digital Mission. Why? Because we feel that as much as the physical infrastructure is required, the physical ecosystem is required, India also needs to now enter into an era where we are able to create a digital health ecosystem. And this digital mission has been launched to serve as a backbone which is necessary to support the digital health infrastructure of the country in the coming times. These are the few important pillars which we are focusing on in order to build an India which can be called developed when we talk about healthcare. Government also prioritizes the need to correct the regional imbalances in the availability of the tertiary healthcare services. And which is why you often hear of how the number of All India Institute of Medical Sciences has increased in the past 10 years. So before 2014, there used to be 6. Now we have 22. And we aim to build more such institutions for the convenience of the common man of this country. I'm also glad to mention that in the past 10 years of our government, there has been an increase of 88% in the number of medical colleges which we have across the country, increase in the UG and PG seats. The UG seats, you would be happy to know, have increased by 118%. And the PG seats have increased by 133%. And the latest announcement of this government, the Prime Minister, from the ramparts of the Red Fort, he said that we will be increasing the medical seats by 75,000. So we will be building more institutions, creating more seats, so we have enough availability of doctors as per the WHO norms, and we are able to fulfill the ambitions of the National Health Policy of accessible, affordable and quality healthcare. The need for healthcare professionals can never be undermined. And healthcare professionals are going to increase by way of not just increasing the number of doctors, but also the paramedicals. And government is leaving no stone unturned to ensure that we have adequate availability of the healthcare manpower. Our commitment to the goals of the NHP 2017 is also reflected in the increased allocation for healthcare. Government healthcare expenditure has been constantly increasing. In 2014-15, as a percentage of GDP, it was barely 35,000 crores, and today we have a budget allocation of 91,000 crores. So as a percentage of GDP, it was 1.13, and today it's 1.9, and after some more years, it's going to be even a greater share, a greater percentage of the GDP. Since we talk about affordability all the time, so we took initiatives like the Jan Aushadhi Kendra and the Amrit Pharmacy, the free drugs and diagnostic, and many such steps to ensure that the out-of-pocket expenses come down with time. And as a result of the multi-pronged approach that the Health Ministry has been adopting for the past few years, the out-of-pocket expenditures as a share of the total health expenditures have consistently declined over time. In 2014-15, it used to be 63%, but it has come down to 47% by the year 2019-20. So we are in 2024. When we have the latest figure, it will be further down. And that is a very important concern, reduction of the out-of-pocket expenditures. Ladies and gentlemen, we also have startups, the concept of startups today, which has been nurtured by this government, I would say majorly because prior to 2016, there were just a few hundred startups in the country. But this government, when it started nurturing the startup culture in India, today you see the scale of progress. India is today the third largest startup ecosystem in the world after US and China. Just few years before, there were just a few hundred startups, but today we are the third largest startup ecosystem. And we have startups in almost every sector today, including space and health. We have more than 1 lakh DPIIT recognized startups. We have unicorns that youngsters are creating. So much of job and employment generation is being done because of these startups. And where are all these efforts going? They're going into building a new India, where youth is no longer a job seeker but a job provider, a job creator. And we talk about, and in recent budget, you also heard that the angel tax was being done away with in order to promote this startup culture. We also have startups in health sector. And these health technology startups have had a transformative impact on the healthcare industry in the recent years. These companies leverage technology to address various challenges and inadequacies and inefficiencies within the healthcare ecosystem, which ultimately lead to an improved patient care and cost savings, and also increased efficiency as far as service delivery is concerned. From diagnostics and treatment to telemedicine, wearable technology, data analytics, and digital therapeutics. All these innovative companies are today shaping the future of healthcare. And as these startups continue to push boundaries of what's possible, the health tech revolution is set to transform the healthcare landscape for years to come. So that's regarding health, what we are doing to change the way the health ecosystem looks today. Apart from health, there's real estate also, there's other sectors also which are driving India's growth story. I will only focus on health, and all I wish to say is that Government of India is committed to fulfillment of this vision. Like my own ministry, there are several other ministries which have a plethora of activities, schemes, programs, all aimed at achieving this big vision. Just yesterday we had our Council of Ministers meeting. Before the elections, we were discussing our plan, the blueprint of the 2047 vision. And just yesterday we discussed how we have to now, because this is our third term, and 2047 means now 5 years are with us. So towards fulfillment of that bigger dream of 2047 of building a new India, prosperous India, self-reliant India, developed India, what is it that exactly we are going to do in these 5 years? Because Prime Minister says we have to work at 3 times the pace at which we have worked in the past 2 tenures. I cannot describe to you the details of our plans, but I can only assure you that India has so much more to see in the next 5 years to come under the leadership and guidance of Prime Minister Narendra Modi ji. We at the government are committed to the fulfillment of this big dream, but as a part of this government, I also take this opportunity to urge each one of you to contribute your bit and encourage others around you to contribute their bit to making India a developed country by 2047. With these words, I once again congratulate TV9 Network for holding this very important deliberation and interaction, and I'm sure this one-day summit will achieve its purpose, its objectives, and each one of you will go back with a deep sense of commitment towards the fulfillment of this dream. Thank you very much.
मैम आपसे आग्रह करूंगी यहाँ पर रुकने के लिए। हम आपके लिए एक छोटा सा आज के समिट के एक यादगार आपको पेश करना चाहते हैं और इसे देने के लिए मैं आमंत्रित करना चाहूँगी रोहित शर्मा, एग्जीक्यूटिव डायरेक्टर बिजनेस डेवलपमेंट एंड कोऑर्डिनेशन DLF होम डेवलपर्स को, साथ ही में प्रताप सिंह सर, प्रिंसिपल कमिश्नर इनकम टैक्स हरियाणा और TV9 नेटवर्क के चीफ ग्रोथ ऑफिसर रतन दास जी को।
मैम आपका बहुत बहुत धन्यवाद, आप आज आए एंड यू ग्रेस्ड अस ऑन दिस वेरी स्पेशल ओकेजन. Lot of us are very excited to talk to you, ma'am. It's a rare opportunity. I want to understand from something that you said, and you talked about how India has done very well when it comes to ensuring that out-of-pocket expenses go down. Now, till date, as an average Indian, we primarily pay out of pocket when we want to go for tertiary health care, or we want to go to our hospitals beyond our own districts. Can you help us understand, ma'am, how has that cost gone down, and what more can we expect from the government to ensure that out-of-pocket expenses go down in times to come?
As I said in my address also, that out-of-pocket expenses reduction has been the top priority of this government. How will that be possible? I'll give you an example, 2-3 examples, which will help you to understand. Like the Jan Aushadhi stores I mentioned. When we took over in 2014, the number of Jan Aushadhi Kendra in the country was 80. Today, you'd be surprised to know that just 10 years, we have been able to increase the number of Jan Aushadhi Kendra to 13,000. And we have an ambition to take it to 25,000. That's the target Prime Minister has given us. And there are as many as 2,047 different kinds of generic medicines, over 300 surgical equipments, which are available on these stores. And when we made an analysis of the sales and the footfall in these Jan Aushadhi Kendras, which have been established all over the country, there has been a saving of 30,000 crore rupees public money in these 10 years. So which is one of the examples which will help you understand how the out-of-pocket expenses have come down. When we talk of these Amrit pharmacy stores are selling medicines at a discount of 50 to 70%. So many people today for heart diseases, cardiovascular diseases, cancer drugs, they are approaching the Amrit pharmacy stores. That is also resulting in savings of the common man. Like Jan Aushadhi stores, where we also send quality medicines but at discounted prices. So these are 2 examples. Then we have so many other initiatives by which we are able to bring down these expenses, like free drugs and diagnostics. That is helping people, and we have a list of essential drugs and diagnostics at our health facilities at the PHC level, CHC level, district hospital level. So it is the common man who visits these facilities. All those free drugs, free diagnostics, all this is helping to curb down the expenses. And then the biggest health assurance scheme, PMJ, 5 lakh rupee health insurance cover. 55 crore people initially covered. We added some 35 lakhs, I think, if I have the number correct, Ashas, Anganwadis. Now we also plan to include additional 70-year-old plus elderly population. So when you provide such a huge cover, how much the government is spending on, I mean, so far 1 lakh crore has been spent on settling the claims of these treatments which people have undertaken under these Ayushman card holders. 7 crore people have benefited out of it. So how much money government is pumping in to make sure that the burden of treatment does not fall on the common man?
थैंक यू सो मच मैम. मुझे पता है आपके पास समय की कमी है और हमने आपको ऐसे रोका, पर आपने बैठ के हमें जवाब दिए. शुक्रिया मैम. मैं आपको थैंक यू कहना चाहूँगी और आपने वक्त निकाला इसके लिए.
Madam Minister, thank you very much, ma'am. Thank you.